Hey everyone, Dr. Alex Ritza, downtown Toronto, neurostructural chiropractor. We're on episode 25 of our Lunch and Learn TV. And today we're going to be continuing our strong knee series. We're going to be talking about strengthening the knees by strengthening the hips. And specifically, we're going to be going through our hip protocol level 2. If you are interested, we have our hip protocol level 1 available for download. We covered it last week in our live broadcast on Monday. And that is available on our How to Fix Your Knees blog as a free download there. So today, guys, we're going to be talking all about focusing on the hips in order to help manage, prevent, and strengthen the knees as it relates to knee pain. Coincidentally, all of these drills are very, very effective if we want to work with somebody that has a core deficit or core strength deficit, if they have low back pain, if they have any spinal condition, SI joint sciatica, yada, yada, yada at all, because it all relates back to strengthening the hips and strengthening the core. And so today what we're going to specifically focus on is a squat and adding some different modifications to a squat in order to have it work the hips and target the knees. Now it's kind of funny, I got a text from my sister yesterday saying her knee was bothering her. How coincidental, we're covering it today. And she was saying, but I've been doing tons of squats and my knee's still bugging me. But sometimes if we're not doing the squats correctly, it can really aggravate the knee. And so a squat is a really great maneuver for strengthening the posterior chain, strengthening the hips, and strengthening the glutes. But like most things in life, it is forward and backwards. It's what we do every single day. And it is up and down, and there's very little side-to-side motion, targeting the glute minimus and medius on the side. And often with just doing squats, we end up targeting only the gluteus maximus if we're not using the proper technique. So item number 1 today, we're going to go over squat. Item number 2, we're going to go over our hip protocol level 2, and we're going to throw in one bonus exercise there. So let's talk about the squat first. There's a few things that we want to work on when we're talking about a squat. And we just recently did our MOVE curriculum workshop night, and what I noticed with most people is they tend to use more of a knee strategy, loading the knees and the quads rather than loading the hips. So let's go into the basics. So when we're doing a squat, it should be a very nice, easy down where we're going to really try to load up and target the hips and move back like we're going to sit on a chair. So squat, you can have the legs wherever you want. You can have the feet kind of ducked out at 15 degrees. And nice squat, you're going to have nice loading of the hips. You're going to come backwards. You're not going to fall. So do that again. And then I can get down nice and low. And so I can hang out here. I'm in good position. You'll notice with me that my tibia is about parallel to my spine. I can even bring my hands up overhead if I didn't have such a tight shirt on. My head is sitting right between my knees. My head is also about over the ankles, same thing with the knees. So these are good criteria. Head right up between the knees. My head and my knees are over the ankles. My tibia and my leg bone and my spine are parallel to each other. And if I was grading somebody on a squat, that would be 4 points out of 5. And the only other thing is being able to be hands overhead while maintaining those other 4 criteria. And that's an excellent squat. And very tough to analyze yourself. You usually need a camera, which we all have, or a friend to analyze and help you with that. So what we tend to see with that, rather than that nice squat, is a lot of people will be a little bit more knee forward, really loading up the knees. When they try to come back, they're still too knee focused. It should really be the butt coming backwards. So what I usually recommend to people before we get into this hip protocol level 2 is just to really ingrain that squat pattern. And I find the best thing is to do a box squat where we're going to work on sitting on a chair. So a really nice drill to practice with is standing about a foot away from our chair here. And we're going to squat back onto it and really sit down. It's okay to come into a full sit and then on the way back up, tighten the core and up, and then really sitting back. And it's okay to come down a little bit hard and to have that nice sitting motion, because that's going to ingrain the feeling of loading up your hips so that you're not using those instead of your knees. So one more. Again, this one, we're going to go back a little bit slower with proper posture. We're going to load up the hips, and then a nice little fall, and then back up and finish by squeezing the glutes. So unless you are an expert with doing a squat, unless your technique is perfect, I highly recommend that you group the pattern a little bit, practice on the chair a couple times. I think it'll be really helpful for when you go through this hip protocol level 2. So let's get started with that. I'm just going to make a small little modification to our camera here. Perfect. So when we get on to hip protocol level 2, the first thing we're going to start with is doing a squat with a TheraBand around the knees. Now, this goes back to where we're talking about my sister with maybe doing some squats, but maybe not doing them perfectly. This TheraBand is going to help us activate the glutes and the gluteus medius and minimus on the side, driving the knees outwards so that we're getting some side-to-side strengthening with our squat, which number one is going to cause some external rotation of the leg, which we know from all our Instagram posts this week is really, really important for protecting the knee and keeping it in a nice safe spot. So let's go through exercise 1. We're going to get our TheraBand around our knees. There's about a 90% chance that this one is going to rip on me today, so we'll see how we do. This one's above the knees, and we're going to go into our squat pattern, and what we're going to do is we're going to hold it for up to a minute. Now, I know most people are usually used to doing 3 sets of 10. With all of our hip protocol, I really like holding it more. I think that's going to provide a little bit better activation, a little bit better strength, a little bit better endurance. And it's just what we recommend. If you want to do 3 sets of 10, go for it, knock yourself out. We find this to be more expensive. We find it to be more effective with holding the pattern. So hip protocol level 1, exercise 1, is nice easy squat, driving the legs outward, getting down into our squat position. See, resistance band broke, knew it. We have the resistance band there, and we're really going to work on driving the legs outward and holding that position. And of course, if you wanted to do 3 sets of 10, that's good as well. The important thing is with the resistance band around the knees, it's going to make us drive the knees outward, activate the glutes, and also it's going to make sure that we're driving the knees outward and not getting the knees in and making ourselves actually predisposed to having an injury. So the nice thing is that we're going to just pretend that I have that TheraBand around my knees because that one is now shot. The next part, we're going to do another squat with the resistance band around our knees, but with this one we're going to add a degree of trunk activation or core activation. So resistance band, we're going to pretend that it's around our knees, and there are 2 ways to approach this. You can either use a really long resistance band that loops around the feet and comes up into the hands, or in this case, I have an FMS resistance tube, which I'm going to use instead. So I'm standing on my FMS resistance tube. It would be the same thing if you had say a resistance band around the knees. And I'm just going to hold these bands here, same thing like you would do with the TheraBand. And on this one, we're going to do a nice, easy squat. Same thing, hold it for 30 seconds, but we're going to maintain that nice upright trunk position as these bands are trying to really pull me down. So it's going to make me engage the glutes, push the knees out. I got my hands in the same position, and I'm really having to activate my core as I drive the legs out and hold that nice squat. And even after about 10 seconds, that's really, really challenging. We're going to work up to a 1-minute hold, and so that's going to be incredibly challenging and something nice to work up to. So number 1 was squat with a resistance band around the knees. Number 2, squat resistance band around the knees and a trunk activation. Now the last one, or the third one we're going to do, same thing, except we're going to do an overhead trunk activation with the squat. So we're really going to bring the arms up, and then we're going to come down and get into our squat. And with the arms up overhead, I'm really having to activate the core and drive the knees out, and it's very, very, very challenging. So this one again, hands up over the head, holding for upwards of 60 seconds, or doing 3 sets of 10, and that's really going to engage the glutes and the core. Should not bother the knee if you're doing it with proper technique, and it's the third exercise from hip protocol level 2. The last thing that we're going to do from hip protocol level 2 is a monster walk or a modified monster walk. So with this one, 2 approaches. You can either do resistance band around the feet, or if you'd like something a little bit easier, resistance band around the knees. So because we lost ours earlier, I'm going to do this with the resistance band around the feet. So with our modified monster walk, the goal is we're going to move straight left and right, driving the leg straight to the side, really activating the gluteus medius and the gluteus minimus. Now, the way I'm going to set this one up, because I have it in my hands, it's going to be a little bit extra challenging because there's going to be a degree of core activation from having to hold the arms up. So, modified monster walk, you get down to a nice small squat position, driving the butt backwards. You drive the foot out, and then the other one slowly follows. And then you drive the foot out, and the other one slowly follows. And you probably do about 10 walks to one side as I go out of the screen, and then 10 walks inside. Good. Perfect. So you'll notice that my core doesn't move. The only thing that's moving is my hip joint. So a bad technique would look something like, where there'd be a big shift here, and you're really getting down and shifting. We want to just see a nice movement with the hip, movement with the hip. Everything's very silent except for that movement through the hip. If you wanted to make this a little bit difficult, of course, you can bring the arms up a little bit higher and really drive out to the side. Perfect. Whew. So I've only done those exercises for about 15 seconds, and I'm sweating, and they are incredibly challenging. You're going to feel a nice little burn there through the side of the hip. So that's our hip protocol level 2. Just a couple of really simple exercises, but if you do them correctly, you're going to get a lot of value out of them. So again, to go over, we got the squat with the resistance band, squat with the resistance band with core activation with the hands mid-level, and then the third one with the hands above your head, and then the fourth one we have our modified monster walks, our monster walks side to side, and then the last one, which I forgot to mention, is the modified monster walk, which we have up on Instagram today. And the difference with the modified monster walk is that rather than going straight side to side, we're actually going to go about 45 degrees backwards. So this is where I'm going to take a small step back and follow, and then switch to the other side, small step back and follow, and back and follow. And so rather than going straight side to side, we're going that 45-degree angle backwards, and that's going to activate a little bit more of the gluteus maximus and the external rotators, and it's going to be fantastic for targeting those. And of course, we're going to do 3 sets of 10 for those as well. If you go through the whole protocol once, it shouldn't take any more than 15 minutes. If you are having a knee issue, if you are working on running a half marathon or a marathon, or if you want to prevent a knee issue, I recommend you do these every single day for at least a month. It's going to take a month for the nervous system and some of the muscles to build a little bit and to also make that better nervous system connection. So try that. I think that's going to be really, really valuable if you put in the time. With knee pain, it's one of those things, if you don't put in the time and put in the effort, it's really, really tough to help improve your symptoms and help improve the core problems in the spine and nervous system that are leading to it in the first place. So if anyone has any questions, feel free to send a direct message, leave a post on Facebook. If in a month's time you find this to be extremely valuable, I would love, love, love a private message saying it was really, really helpful. Or better yet, put a message right up on Instagram or put a message on Facebook, tell others how fantastic it was. We're going to be coming out with this in a paper form as a download very, very soon. So check out our blog that it should be coming out in the next couple of weeks if you want that. Otherwise, I hope everyone has an amazing Monday. I'm going to sign off. Dr. Alex Ritza, downtown neurostructural chiropractor. Share this with anyone that has knee pain or needs help. And I hope you guys have an amazing day. Peace. Love you guys. Bye.